Your low back has been hurting for a few days, maybe weeks. You're not sure if you want to rest or you need to go to the doctor and get checked ASAP. This video is here to help you make the right decision. To do so, I'm going to present you a review talking about the main indicators of serious pathology in low back pain that we call red flags. Let's start with something that is a bit obvious, but this is bad for your back. I guess we can all agree on that. The question is, should you get to the doctor or not? The plan is simple. We just don't want to have fractures or sprain in this area. When you're young and the impact is significant, such as a car accident, then the problem is solved immediately. Yes, you need to go to the hospital. If the damages are superficial, then we can deal with a bruise, which means only your soft tissues are going to be damaged. In that case, we expect the pain to decrease within the next few days. If the pain is not vanishing for days, maybe sometimes weeks, especially at night, then you need to get checked to make sure there is nothing broken. When you're getting older, this is going to be the same story. The only thing that is going to change is that you need to consider even minor impacts, especially if you have osteoporosis. So here is what you need to remember for that part. You had back pain following a trauma, major if you're young, minor if you're getting older. The pain is either acute or it's just persistent, especially at night. Then you need to get checked to make sure there is no sprain and no fractures. We are now dealing with evil tumors. Of course, it's difficult to be 100% positive as we don't have x-rays in our eyes, but in the guidelines, two red flags are always mentioned. One, if you have a history of cancer, and two, if you have an unexplained weight loss and fatigue. This is what you need to remember for that part. The pain appeared with no obvious reason. You have a history of cancer. You have an unexplained weight loss and fatigue. In that case, you need to see what's going under and you need to get checked. We now need to talk about viruses and bacteria. Why them? That's because, like every living organism, they need a place to survive. HIV targets white blood cells called CD4. COVID targets lung cells, which means they need an organ to survive. And the thing is, we have plenty of them in the abdominal area. That's why they can absolutely mimic a low back pain. Gladly for us, not entirely. Most guidelines mention that fever is going to be present. That doesn't mean that you need to freak out every time you get the flu, but some contexts are worse than others. First, we can mention if you use a treatment that lowers your immune system, for instance, when you just had a transplantation. The other thing you need to think about is if you use any treatments or other things that involves a needle. Besides, some guidelines mention that if the pain goes on at night and sometimes is even worse, that might be a positive sign that one of your organs has been infected. In that case, the more you're going to wait, the more the infection is going to spread. So this is what you need to remember for that part. Low back pain with fever. You use a treatment that lowers your immune system. And 3, you use a treatment that involves a needle. And 4, we can also mention if the pain goes on at night and is sometimes even worse.
Come on with your hands up!
The equina syndrome. What? The name of this syndrome comes from the fact that right under your second lumbar spine, the nerves are more or less free to go, which makes them look like the tail of a horse. Those nerves are very involved with any function that happens around the hips and below, which means we can find a lot of symptoms. However, only a few of them are considered as red flags. The first one that is frequently mentioned in the guidelines is called the saddled anesthesia, which can be described as a reduced sensation in the area that would be in contact with a saddle if sitting on one. The second one that is frequently mentioned is the bladder dysfunction. which can be described as incontinence or any lack of control you have in dysfunction. It is only enters as a red flag here in this video when it's combined with a low back pain. Those nerves are also very involved in anything that has to do with the sexual functions. Once again, do not freak out if you are not at your peak performance in this function. We can find many reasons for that. It is only enters as a red flag here when it's combined with a low back pain. Looking for something, my friend? So, this is what you need to remember for that part. Low back pain with bladder dysfunction, or saddle anesthesia, or sexual dysfunction. On this part, we're going to have a quick view on red flags that are unrelated to specific pathologies. First winner being less than 20. We need to cross that with different factors such as acute pain, persistent pain, pain at night. The purpose here is to make sure that the spine doesn't have any structural deformity. Well, now that's the opposite. You're over 50, or sometimes they say 65. But if we put it on just like that, it doesn't really make sense. Let's say that as you're getting older, you're just more at the risk of fracture, osteoporosis, tumor, cancer. Getting older looks awesome. So we need to take care of the context. Meaning, your back pain did not appear for apparent reason. It is acute, it is persistent, might be even worse at night. Losing strength in your lower limbs is a sign that there is something going on, especially if that is progressive. Here is an example where I'm unable to clear my toes from the floor. It's called dragging. In this example, I am unable to prevent my foot from hitting the floor. I presented you the main red flags as they are described today, but there are a few things to say as a conclusion. First, those red flags are from different guidelines, as there is no worldwide consensus. So there is a chance that this list might move in the next years. 2. One red flag does not mean that you need to stop the whole world. You need to take care of the whole context. But if you have many of them, then you need to trigger the alarm and get to the doctor as soon as possible. So this is it. That's the list you need to remember. I hope you found this video helpful. Don't forget to subscribe or leave a comment below. Thank you for watching. See you next time.